Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. What are all the precautions that a PCOS women has to take? It is very important. We will discuss. There are simple 4 points. The first point is diet. What type of diet a woman should take? She should take less carbohydrate food. So normally you will be eating once in morning, afternoon, evening, and night, and also you will be eating in between. Mostly you will be eating carbohydrate food. You have to cut down the carbohydrate food. Eat 3 times a day, if possible 2 times a day or 1 time a day. It is very good for you. So reduce carbohydrate as much as possible so that your carbohydrate regulation and insulin regulation is increased. Next, take the food in very less frequent intervals so that you will have long hours of fasting and your glucose metabolism is regulated. Next one is cut down the saturated fats or fatty foods. When you cut down the saturated fatty foods or any other fatty foods, so your obesity will be decreased. Decreasing the weight of the female is very important in case of PCOS. Next comes the exercise. What type of exercise you have to do when you are PCOS? So the exercise you have to do is called zone 2 cardio exercise. In zone 2 cardio exercise, you can do brisk walking or cycling or swimming, but it should not be huffing and puffing. So the oxygen demand should not be increasing. The good measure for that one is you can talk to your friend on phone so that the friend can infer that you are on exercise, but you will not feel any difficulty. So there you should be breathing in from nose and breathing out from nose as well, not from the mouth. So you have to do medium intensity so that your glucose metabolism is regulated. When there is no huffing and puffing, when there is in zone 2 cardio exercise, fat is a substrate for energy. You are burning the fat and producing the energy. If you are huffing and puffing or doing some higher intensity exercises, there you need carbohydrate. So here fat is a substrate. Fat from your adipose tissue and from your visceral tissue, visceral fat and adipose fat is coming and it is converting into energy so that your fat metabolism is regulated. After that, next important thing is sleep. Sleep is very important. You have to sleep for at least 7 to 9 hours per day. When you sleep 7 to 9 hours per day, there is no organ that is going to be benefited. And if you deprive of your sleep, if you are sleeping less than 7 hours or 6 hours, that is not going to be damaged because of this sleeping habit. Sleep is very important. Sleep will reduce the stress. Sleep will regenerate each and every function of your body and part of your body so that your PCOS is regulated. Next thing is, after exercise you have to have stress free life. So nowadays women are going out to work and there is lot of stress at the workplace. So whatever you do, you have to try to reduce the stress. When there is high stress in you, the hormone cortisol is produced and also adrenaline is produced. Adrenaline and cortisol are again fat depositing hormones. If you have high levels of cortisol, high levels of adrenaline, you will going to become obese again. So these are the 4 points you have to keep in mind to reduce your PCOS. We look into the complications of PCOS. There is only one final complication when there is elevated levels of estrogen in your body or in your blood. So it causes proliferation of endometrium. When the endometrium is continuously proliferated, it may go into cancer. So that is the important thing. You have to get treated for PCOS as early as possible to not to land into this uterine cancer.